hospitals and health centers in Kenya, there is a shortage of staff who are trained to handle premature birth cases as well as the necessary equipment. Where incubators are available, they are often inadequate, meaning that newborns have to share, leading to nosocomial infections. In addition, incubators are poorly maintained, and the lack of a reliable power source means that the temperatures fluctuate, which may cause hypo or hypothermia. Approximately 500 babies are born in Kenya before gestation period is over. An innovative solution to this problem was hatched and is dubbed the Kangaroo Mother Care, KMC.
Kangaroo Mother Care is a very simple, cost-effective interventions that can save up to 48% of newborns in terms of those ones who would have died just because of prematurity. We can save up to half the number of the newborns just using Kangaroo Mother Care.
Kangaroo Mother Care refers to the care of preterm infants carried skin to skin with the mother. KMC is a powerful, easy-to-use method to promote the health and well-being of infants born preterm as well as babies born below 2.5 kilograms.
Other than prematurity, we also have got low birth weight babies who need further support, as we know that these babies are liable to hypothermia and therefore it affects their ability to survive. Our newborn care unit has almost 25 babies at every one time. However, we only have 2 functional incubators in those departments, and the heater that is there can serve a very small population of those babies.
There are 2 types of KMC: continuous KMC, intermittent KMC. Continuous KMC takes place when the baby is skin-to-skin position for at least 20 hours every day, except for very short periods, for example when the mother has to take a bath or use a toilet. Intermittent KMC, baby is put on skin-to-skin contact for a few hours each day. When not in KMC position, baby is kept warm in an incubator or warmly wrapped. Mostly used for very small and sick babies and or for mothers who do not want or are not yet ready or able to practice continuous KMC. Features of KMC: early, continuous and prolonged skin-to-skin contact between the mother and the baby. Exclusive breastfeeding, ideally. Small babies can be discharged from health facility early. Benefits of KMC: it is initiated in hospital and can be continued at home. Mothers at home require adequate support and follow-up. It is a gentle, effective method that avoids the agitation routinely experienced in a busy ward with preterm infants. Kangaroo Care helps both infants and parents prevent infections and record systematic growth. Mothers report being significantly less stressed during Kangaroo Care than when the baby is receiving conventional care. Research and experience shows that KMC is at least equivalent to conventional care, incubators, in terms of safety and thermal protection if measured by mortality. KMC, by facilitating breastfeeding, offers noticeable advantages in cases of severe morbidity. KMC contributes to the humanization of neonatal care and to better bonding between mother and baby in both low and high income countries. KMC is, in this respect, a modern method of care in any setting, even where expensive technology and adequate care are available.
Babies who are born before 2.5 kilos, and especially the preterm babies, they are normally put on supplements. And when I talk of supplements, they are put on Mixavit syrup, saffron, and folic acid. This is to help mature the bones and so that this child can grow up and maybe follow the milestones like any other child. So because of that, when they are discharged home, there are those who are told to come back after 1 week, others come back after 2 weeks. And then as they come, we weigh them, we look at the progress, how the baby is gaining weight, and then they are seen by the doctor. We come together, we talk about the challenges, and then we find out whether they are still having these supplements, because they are supposed to use the supplements up to 1 full year, and that is the only time we are sure that this child is now okay.
Research and experience shows that KMC is at least equivalent to conventional care incubators in terms of safety and thermal protection if measured by mortality. KMC, by facilitating breastfeeding, offers noticeable advantages in cases of severe morbidity. KMC contributes to the humanization of neonatal care and to better bonding between mother and baby in both low and high-income countries. KMC is, in this respect, a modern method of care in any setting, even where expensive technology and adequate care are available.
What the Save the Children did as an organization, they worked together with the hospital management, and we identified a room. In this room, Save the Children helped us to do renovations, and currently we have 8 beds for the mothers, and among those patients who come, we have the mentor mothers who take other new mothers through the whole process of kangaroo mother care. And from the time it was begun, this has helped to save a number of babies who otherwise we could have lost because of the complications of prematurity.
Adjustable beds with pillows to allow for reclining, bedside cabinets, heaters, chairs, a low reading thermometer, a wall thermometer, NG tubes, measuring cups, feeding cups, graduated feeding cups, fridge to store expressed breast milk, neonatal scales with 10G intervals should be used, basic resuscitation equipment to include a suction device and a bag valve mask device. The bag should be 500 milliliters size and the mask should be in preterm, that's 0, and term 1 size. Oxygen should be available both in low and high flow forms. In our settings where concentrators are in wide use, oxygen from cylinders should be available for high flow use, e.g. during resuscitation. Piped oxygen caters for both situations. Pediatric flow meters, nasal prongs, masks and pulse oximeters. Drugs for preventing and treating frequent problems of preterm newborn babies may be added according to national guidelines. Bilirubin blanket.
So far we've had preterm babies go through kangaroo mother care and 406 of them have graduated, meaning they have attained a normal weight which World Health Organization defines as 2.5 kilograms. After discharge, we follow them up in the clinic and we see them every week until they are 2 kilos and then see them twice weekly until they are 2.5 kilos. Thereafter, we see them monthly until the age of 1 year. During follow-up, some of the things that we check is how the baby is feeding, how the baby is adding weight, and how the baby looks clinically to look for the possible complications of prematurity, especially anemia of prematurity.
A KMC facility will allow health providers to provide quality for care to preterm babies. Any family member can carry out KMC, including mother, father, grandmother, aunts, and older siblings. It is recommended that all babies less than 2,500 grams should be initiated on KMC as a mother is transferred from labor ward to postnatal ward.
Nilikuja hospitali, nilikuwa nasikia maumivu. Vile niliingia nikapelekwa kwa labor na nikazaa mtoto akiwa na miezi 6 au wiki 2. Wakanileta hapo nursery. Mtoto alikuwa amekuwa na kilo ya grams 900. Sasa amekaa hapo ndani kwa hiyo muda yote mpaka saa ameingia kwa 1.1.
I also help her in the kangaroo. I usually travel from home to here. After 1 to 2 days, I come to assist him. assist her, to take care of this boy. I'm very sure that after this, he's going to survive very well, because when he came here, he used to suck the milk, the food, through the nostril, through those strings. But right now, he's capable of just sucking direct from the mother's breast.
Eligibility for admission into KMC by birth weight. All stable babies born below 2,500 grams should be put on KMC. Stable babies between 2,000 grams and 2,500 grams should be evaluated by a health worker, mother cancelled on KMC, baby initiated and discharged on KMC. All stable babies below 2,000 grams should be admitted into a KMC unit and started on KMC. Stable babies weighing between 1,800 grams and 2,000 grams can be started on KMC soon after birth. Babies between 1,200 grams and 1,799 grams should be stabilized, then started on KMC as soon as possible. Babies weighing less than 1,200 grams should be transferred immediately to a center that can offer intensive neonatal care. It may take weeks before their condition allows initiation into KMC. Depending on facilities available for the transfer, KMC can be utilized to keep the baby warm during the transfer to the higher level facility.
Before we initiated KMC in Siboti Model Health Center, we were given support by Save the Children International, whereby a few of our staffs were picked and trained on kangaroo mother care. Then a kangaroo mother care room was partitioned and renovated. Then we were given a heater. We were given baby linen, baby outfits, then some linen. Then also we were supplied by infection prevention buckets, then plus many other things. Then we started on with a kangaroo by admitting our first client. Then from that point, from 17th November up to now, we have had 21 babies on kangaroo mother care, and we have graduated 20 of them. They are alive, strong, and doing well.
Started support groups where mothers come and they meet and discuss how they are taking care of their babies. And during those support group meetings, we also use them to teach the other mothers who are within the newborn unit. When they see the babies who have been through KMC and they are growing well, they are also encouraged to continue doing KMC for their mothers. We also have KMC champions who are used to communicate with the mothers, and we use this program of KMC champions to be able to help other mothers who are not doing well in KMC. We have also incorporated kangaroo mother care in the community health volunteers program so that they are able to help us to trace children who have become lost to follow up or who are not coming back for follow up in the clinic, or also those who have been born within the community and they are preterm, to help them to be referred to the health facilities.
The best time to discharge baby on KMC is when the general health has improved and there is no concurrent disease such as infection or apnea. They also need to be feeding well and is exclusively or predominantly breastfeeding, gaining weight of at least 15 grams a day for at least 3 consecutive days. Temperature also needs to be stable, meaning within normal for at least 3 consecutive days. The mother is confident in caring for the baby and is able to make regular follow-up visits. Baby should immediately be returned to the hospital if they stop feeding, is not feeding well, or is vomiting. If the baby becomes restless and irritable, lethargic or unconscious, has fever, body temperature above 37.5 degrees, is cold, hypothermia, body temperature below 36.5 degrees despite rewarming, has convulsions, difficulty in breathing, has diarrhea, shows any other worrying signs. Readmit a baby if gained less than 15 grams per kilogram per day in 2 consecutive weekly follow-up visits, baby did not gain weight at all, baby has lost weight, baby is sick, if there is no one to continue providing KMC, and baby is less than 2,000 grams.
Kangaroo mother care can be integrated in many ways. Firstly is just ensuring that kangaroo mother care messaging is part of the healthcare messaging that is shared with mothers, especially at the antenatal clinic. Those mothers who are just who have just gotten pregnant, they need to be informed about the possibility of a premature birth, and in the event of a premature birth, kangaroo mother care is one of the life-saving interventions that they need to be aware of. So that needs to be mainstreamed to ensure that at least the messaging right from the antenatal care is quite clear, that kangaroo mother care is a life-saving intervention, so mothers can be shown what kangaroo mother care is actually means and what potential it has in terms of saving their newborns. Another important consideration is including kangaroo mother care in courses such as emergency obstetric and newborn care, right? We have training of health workers, a package of training healthcare workers, which must include kangaroo mother care. In that way, we're able to see more integration, that the health workers are practicing kangaroo mother care not as a separate thing, but as something that is just integral with the general antenatal care to postnatal care sort of care or service that is offered during that period. Another way that could be of potential is that including kangaroo mother care in pre-service delivery, so that the doctors, nurses, clinical officers, and any other health practitioner out there will do kangaroo mother care or study about kangaroo mother care in college. By the time they're stepping out of college, they know what kangaroo mother care is, and when they come to the health facilities, that's something they're going to propagate, which means it is something that will be inborn in the system. Another way of looking at it is ensure, and this we've done, is that just to ensure that each newborn unit, for example, would have a separate room that has kangaroo mother care. So the newborn unit and the kangaroo mother care is looked at as one, because these are all babies of the same cohort, same stage, needing almost the same service. So while the doctor and nurse will go to the newborn unit to check on patients, they will also go and check the patients under kangaroo mother care. In so doing, kangaroo mother care is not seen as a separate sort of intervention.
Maternity services are free. All the kangaroo mother care services are also free. So we welcome all of you to come and get the services.
Nafurahia hiyo mradi ya kangaroo sana. Juu imetufunza mengi kama sisi wazazi. Hata tukitoka hapa tuende huko nyumbani, pia si tutafunza wamama wengine wenye hawajaipitia kwa hiyo mradi wa kangaroo.